We had problems with the lecture capture the other day. I tried something different, so we're going to see if it worked today. So if you are skeptical, then feel free to use your phone or some other recording device. That is perfectly fine with me. All right? Okay, I'm going to switch to the document camera for just a moment because a lot of people are a little bit hesitant when it comes to fluid electrolytes because it sounds like chemistry class. And it is, but not to the same level. So let me show you this little. All right, so sometimes what we say, we think makes perfectly good sense. So if I say something that to me makes perfectly good sense, but it doesn't to someone else, please at any point feel free to stop and ask the questions, okay? All right, we're gonna switch over to the computer now. I'm gonna turn this little rascal on and wish for the best. Right now it looks hopeful. All right, so when we're talking about fluid electrolytes, the first thing we want to address is what we refer to as intake and output. You've talked about it in skills lab already, but let's clarify some things. The intake is very simply all fluids that are entering the body. So there are no. All right, we've already got a glitch on this end. Hold on just a second. I had the big screen working and now it clicked off. Had something on the document camera, switched to desktop like our previous problem, and this time it lost me again. All right. All right, give us just a moment. We'll get things up and running again.
Yes.
Okay, sounds good. Okay, I'm presuming that Enid can hear me as well, so I'm going to go ahead and get started. Stillwater. So when we're talking about fluid electrolytes, if we focus on the fluid side first, we're going to talk about intake and output. So remember, intake is everything that enters the body in fluid form. So we're not talking about nutritional intake, we're not talking about dietary intake. So when you are instructed by a physician's orders for I&O, we're talking about fluid. We're not talking about nutrition and diet. Okay, that's a separate flow sheet, a separate place. All right, so naturally we consume fluids through both our food and our fluids that we drink. Food has a very high concentration of water, at least most substances do. But we also have sources that are instituted by healthcare professionals, primarily nurses under the prescriptive authority of providers. So it might be through the veins, which would be intravenous or IV. Might be through a NG tube or a nasogastric tube. It might be through a tube feeding, which may go through the nose or may go through directly through the abdomen, etc. So intraosseous, there's other things that would fall under, etc. there. But regardless of the source, be it natural or healthcare initiated, the human being needs approximately 2,500 meals in a 24-hour period. Output is all the fluids that are lost from the body. So that's pretty simple. Be careful you're not inclined to say intake and outtake. That's not how we refer to it as input. It's intake and output. Okay? Natural forms of output include our urine, our sweat, and even the moisture that we exhale as we breathe. Our sweat and our exhalation, our condensate that's in our breath, we refer to those as insensible losses. In other words, they can't be measured, but they are real, and they are significant over the course of a 24-hour period. Some people estimate it to be approximately 500 to 1,000 meals a day is lost through the moisture of our skin and our exhaled breath. And then feces also contains a portion of fluid as well. About 1,500 mils of chyme enter into our, is processed by our bowel each year, but only about 100 is left behind. The rest is absorbed into the bloodstream.
Did you say
Healthcare, sometimes we draw blood from people, or sometimes they have injuries. So we may see a hemorrhagic event that would cause a person to lose blood, or a surgical event would be an example of blood loss. Vomiting is also an example. Sometimes we connect that NG to suction, and so we use suction to remove things from a person's stomach when they don't have peristalsis. Diarrhea is another form that we observe in a healthcare context. Although some people would argue this is naturally occurring, we don't induce diarrhea, and I agree, but the context is that diarrhea is not a natural phenomenon as far as in healthy phenomena, okay? And then obviously our output should be approximately equal, but because of those insensible losses, your intake will typically always be greater than your output, and by between that 500 and 1,000 meals. So since we have difficulty measuring some of those insensible losses, the more accurate way to measure a person's change in fluid status is through a daily weight. You're obtaining the weight changes over time. Significant changes in a person's body weight, so in a 24-hour period, equals a fluid status change. That's not a caloric issue. So a person who loses more than or equal to 5 pounds in 7 days is most likely experiencing a fluid deficit, even if they've experienced it as a result of weight loss, not as a result of weight loss, as a result of dieting, okay? 2.2 pounds or 1 kilogram in 24 hours is also an example of, most likely, that is fluid loss. When we lose that amount, it roughly equals 1 liter of fluid. The other side of that fluid electrolyte equation is the electrolyte part. And electrolytes, by definition, is simply those particles or those solutes that are in our body fluids that are necessary to maintain life. So when we looked at the mineral components of nutrition, minerals are electrolytes. We have positive electrolytes that we refer to as cations, and the four major ones I've listed there for you. So that is sodium, potassium, calcium, and magnesium. And for those of you who've had chemistry class, either in high school or college, the electrolyte charge, or the electrolyte equivalent up there, is indicated by the number of plus signs. Negative electrolytes or negative ions are what we refer to as anions, and they have a negative charge, a negative electrical charge. And so this is chloride, this is phosphate, and this is bicarbonate. And those are your three big ones within the human body. But besides electrolytes, we have other things circulating in our body fluids, and specifically, more importantly perhaps, in that vascular space. Pardon? Does somebody have a question? No? Okay. So we have other things in that vascular space, and those are those non-electrolytes, and some of those we talked about in the nutrition class, which was glucose, proteins, and the lipids. So these are very large molecules in comparison to the electrolytes, so they do influence our fluid balance between the compartments, and we'll talk more about that here in a little bit. But recognize they do not carry electrical charge. Now, why are the electrical charges important? Is because our body likes to maintain the same amount of electrical charge on both sides of a membrane. So if you remember from the review I put out on Blackboard, where we talked about a semi-permeable membrane, and we talked about the different fluid compartments. And so we talked about those, and we're going to review those in just a moment. our body likes to keep the same amount of positives and negatives on one side of that membrane and the same amount of positive negatives on the opposite side. That's homeostasis, or that is balance. Okay? Electrolytes are lost from the human body in the same way that water is. So through perspiration, through feces, through urination, that's how we lose electrolytes, just like we talked about losing water. When water loss occurs, it always takes electrolytes with it. And so depending on what body fluid is the loss you're experiencing will determine the ratio of electrolytes that you lose as well. So for example, if it's coming from the stomach, you're going to lose a high volume of potassium and chloride as part of your stomach acid. Purposes of electrolytes have multiple things, but the main three ones that we want to think of is they promote normal body functions. They allow chemical equations to occur. Nutrition is so vital to this discussion that I'm thankful that you were able to receive the nutrition lecture first. Remember, everything that we're talking about today must be obtained from outside the human body. Our body cannot generate electrolytes. Those are essential minerals that that were mentioned by Mrs. Haig in the nutrition lecture. But without them, your body cannot do the things it is programmed or designed to do. In adult 2, you'll talk about acid-base balance. We talked about it just momentarily. I mentioned it in the respiratory lecture. Acid-base balance simply means that every fluid compartment prefers a certain pH in order to carry out its functions well. And so the electrolytes is what helps maintain the appropriate pH in each of those fluid compartments. And then the last purpose is it helps balance those body fluids between compartments through those 4 processes that I discussed in that review time. Electrolytes, when we're measuring them in the vascular space, so with our lab, our blood draws, are typically reported in milliequivalents per liter or in milligrams per 100 milliliters. And sometimes you might see that as milligrams per deciliter. Okay, so 100 milliliters is a deciliter. Homeostasis. What is homeostasis? Anybody?
Maintaining balance.
Maintaining what?
Balance.
Enid says maintaining balance. Did you hear us? No.
He's talking.
I've looked at the blood draws and stuff, I measured them. No.
And so homeostasis, so as I mentioned in the review, that there is water and electrolytes in all of those body compartments that I discussed and demonstrated for you. And when they are properly balanced, when they're in the right or correct ratios, that's referred to as homeostasis with respect to fluid electrolytes. We have homeostasis in all other areas of body functions as well. Homeostasis means that at constant normal levels of fluid and electrolytes promote normal, healthy cell function.
Could you say that again?
So when there begins to be an imbalance of those, when that ratio changes between water and solutes or water and electrolytes, our homeostasis is disrupted, and it doesn't even take very much to start that process. Our body recognizes if we don't fix this quickly, then our body's not going to be able to do things in a healthy, life-sustaining way. So your slide says 1 to 2%. So it's not like somebody begins to conserve water and electrolytes when they're already dehydrated. No, that conservation process started long before we ever see symptoms, long before that patient ever feels those symptoms. Okay? So let's talk briefly about those fluid compartments. So on your slide there, Tonkawal, what does the intracellular fluid compartment refer to?
But inside of the cells.
That's right, the fluids inside the cells. Extracellular, Enid, what does that refer to?
Outside. Outside.
Okay, and Stillwater, which one is the larger compartment? The intracellular, very. So when we look at that intracellular, or extracellular, I mean, we break that down into 3 other subdivisions that I've listed there for you, and lymph is kind of an extra there. Intravascular means within those blood vessels, and I demonstrated that with the little red capillary that I showed in the picture. Interstitial is that area that is around the cells, so there's not free air between those cells. Everything is touching liquid between those membranes. And again, if you go back to that AMP review, about 60% of the human body is water. Okay, so our cells are engulfed, if you will, by that interstitial fluid. Transcellular fluid is fluid that's within body cavities. So we're talking about things that we've already talked about, like pleural fluid, pericardial fluid, cerebrospinal fluid, the fluid in your synovial joints where you move. All of those are transcellular. And then lastly is the lymph. Sometimes people will refer to the interstitial fluid and lymph as the same fluid, okay, because the interstitial fluid drains from the body into the lymph system, okay? All right, any questions about any of that? So let's just briefly go back over what, again, was in that review. So there are 2 primary forms of transportation of fluid electrolytes between those compartments. One is passive and one is active transport. Tronquois, how is active transport different from the mechanisms of passive transport? Requires energy. Specifically, it requires, in most cases, ATP. Okay, so when we're talking about passive transport, there are 3 different processes that I need you to grasp. It's very significant that you understand these because everything else makes sense when you understand how these things move. So in osmosis is the water moving from one side of that membrane to the other. Diffusion is when the solutes move. So the electrolytes or the other substances that are dissolved in that compartment. And then lastly, filtration is when both move. And I explain each of those processes in more detail in that review. So I'm not going to take time to do that right now because I do want to get to our activity that we're going to do on next Tuesday. All right? Active transport, the substances move from a lower concentration to a higher concentration because they have the help of that energy source. Okay, so they're able to move against that concentration gradient. And again, there's some good pictures in your textbook that demonstrate some of that. And my little low-tech use of pom-poms on the PowerPoint and on Blackboard demonstrates that for you as well. So some other terms we need to understand in order to understand the rest of our conversation today is osmolality, is talking about the total solute concentration within a fluid compartment. I think we're at Enid. Enid, what's the only fluid compartment we can actually measure with precision the electrolyte component?
They said vascular or blood?
That's right. It's the intravascular fluid compartment. Everything else, all the other extracellular is not accessible. You can't measure it easily in that interstitial fluid. Now you can draw a sample from the transcellular areas, so we can draw cerebral spinal fluid, we can draw synovial fluid and measure things in there, but we only do that when there's a problem, when there's a demonstrated problem we're trying to identify. Osmotic pressure is the power of a solution to draw water across that membrane. So osmotic pressure is primarily generated by the electrolytes in that compartment. And so when we're talking about extracellular fluids, still water, what's the major cation that's going to create that osmotic pressure? What's the major cation in extracellular fluid? Sodium. So the sodium concentration has the greatest effect on osmotic pressure, but the other electrolytes factor in on a smaller level to add to that as well. Oncotic pressure is very similar, but this is where those non-electrolytes come into play. Oncotic pressure is the power of the proteins in that compartment to draw water into the vascular space. So our albumin levels, our total protein levels, or our red blood cell, white blood cell, and platelet levels, all of those are proteins in the plasma. Our hormones, our antibodies, our clotting factors are all plasma proteins. All of those things together generate pressure to keep the plasma portion, the water portion in our blood, in the blood vessels. So, where are we at now? Tonkwall, what would happen to somebody's fluid status in the vessels if they were anemic?
Wouldn't it drop?
In what way, Teresa?
Because there's not as much red blood cells to help carry some of the cations.
Well, it's not the red blood cells carrying it. What it is that oncotic pressure issue. So when any of those protein levels drop, whether it's because they're anemic or whether it's because they are protein deficient, so maybe their albumin levels are low, they are protein malnourished, if you will, then the plasma will begin to leak out into the tissues, and the plasma will begin to leak out into the lungs, creating what we call peripheral edema and pulmonary edema. Edema occurs within the interstitial space. Please make note of that. Understand that that's where that fluid is. Edema is not in the cells, and edema is not in gorged blood vessels. It's the fluid in between. In just a moment, I'll show you. No, I can't. I'm afraid to go back to the document camera because we'll mess everything up again. Maybe they'll get this fixed between now and next Tuesday, and I can flip back and forth. Hydrostatic pressure is the amount of pressure exerted by a fluid within a closed system. So when we have a beating heart and we have blood pressure generates a certain amount of hydrostatic pressure. In other words, a certain amount of force against those blood vessel walls. So these two pressures, osmotic and oncotic, work in opposition to this to keep the fluid balanced within our blood vessels. If this is too great, if our hydrostatic pressure is too great, you can find my cursor, if our hydrostatic pressure is too great, then the fluid will not stay in the blood vessels, it will be forced out into those tissues. If either of these are too low, the same thing occurs. Someone who has a compromised cardiac output, even if these pressures are okay, they have a compromised cardiac output, they begin to develop peripheral edema and pulmonary edema as well. Somebody who is has an excessively high blood pressure can develop pulmonary and peripheral edema as well. So either direction, and that fluid doesn't stay where it belongs. All right, so for just a moment, I hope that all of you took time to look at that picture, because since I can't show you, I still want to talk about that for just a moment. The picture where I used the little cells and the blue fluid was the interstitial fluid, and then the capillary that ran through that picture. What I want you to think about for just a moment is, when we talked in the circulation lecture, I sure would like to switch this back to me so you can see me instead of just a slide, but I'm afraid to do that too. All right, so you just have to imagine Mr. Baird for just a moment. All right? No, that's not a good imagination. So keep looking at the slide and enjoy things a little better, all right? What I want you to do, though, for just a moment is recognize that everything those cells need has to come down the pike, has to come through the circulatory system. We talked about the circulatory system as being an in-house courier system. Everything the cells need, they ask for, and the circulatory system delivers it. If you remember from that picture, the circulatory system does not have a direct access to the cells. So the oxygen, the glucose, even the proteins that those cells need to do their job must first diffuse into the interstitial fluid and then diffuse into the cells. And then when the cells get done using what they want, and so they create a mess, kind of like your kids in glitter, you know, when you pick up and scoop up all the leftover glitter that fell on the carpet or fell on the table, and we want to get rid of it, then we have to do the opposite. The cells send it out into the interstitial fluid. If it's small, it will then be absorbed back into the bloodstream directly. If it's big, the lymph system will carry it down to the nearest lymph node, which is like a garage door, so it has a bigger doorway, and then it gets back into the bloodstream that way. So the reason I'm telling you in that detail is what happens to the diffusion of oxygen, nutrients, so glucose, protein, even the other electrolytes that cell needs to maintain its function. What happens if there's too much interstitial fluid? Are the cells compromised? Can they easily get what they need if there's too much fluid in that interstitial space? If peripheral edema is there, it's too much pressure. And so they may or may not be able to easily get the oxygen and nutrition they need. So while some people would think that edema is a trivial thing, it's not when it comes to the human body. It's very significant. It interferes with those cells being able to get what they need. Many of you have already seen wounds for people who have heart failure or people who have diabetes, and those cells are not, or those tissues are not healing. And they're not healing because the body can't get those things to those cells the way they're supposed to. The opposite is true as well. What would happen if the interstitial fluid wasn't there to make that exchange? So now the cells may be touching the capillary wall, but there's just a microscopic pathway there that there's not enough fluid to transfer. So the same thing. Things accumulate into the cells to the point that sometimes the cells die. They can't get rid of the waste products that they just generated, and the glitter just fills up the whole living room. Okay, you can't live like that anymore, and the cells die. So what we're talking about is significant even on that cellular level. Okay, any questions about any of that? Okay, you all are a quiet bunch. So how does our body regulate something that is so significant to sustaining its functions, to sustaining its life? Well, the first thing is we need to regulate the intake. And as I mentioned out there in that review, our primary mechanism is our thirst mechanism. That little part of our hypothalamus that says, I need a drink. And so when we take a drink, our thirst is relieved, but it only stays away for about 15 minutes. But remember, it takes about 30 minutes to an hour for what you drink to get into your blood. Okay, so what stimulates our thirst mechanism is when our blood is too concentrated. It doesn't have enough fluid in it. Okay, so, and I mentioned 3 different situations like that in that A&P review. So when that thirst mechanism is generated and it subsides and stays away for about 15 minutes, we still have not replenished our fluid need. And so we feel thirsty again. And yet the reason why that thirst stops after we take just a small drink is because it's trying to prevent us from getting too much. We don't want to overhydrate the vascular space because that's a problem too. that leads to that peripheral and pulmonary edema problem that we just talked about. When we're talking about output, our primary regulator is the kidneys. So they work in conjunction with the cardiovascular system and filter out the surplus water and the surplus electrolytes and those waste products that we were just talking about. They get rid of them and send them out to the trash dump. And it uses those three hormones to create that balance. So let's see, I'm not sure where we're at. Let's start with SOAR. What does ADH do with regards to the kidneys? Talk to me about what it does and where it comes from. Anybody?
It wakes the kidneys up.
Wakes the kidneys up? That's a way to think of it.
That's what, those are your words when you talk about the very first line.
Oh.
Kidneys, hello, wake up down there.
Oh.
Let's get the fluid out of the body.
Actually, that's not the ADH, that's the one at the bottom of our list. That's the A and F.
This one holds fluid, right?
This one holds fluid. Anti means it opposes. Diuretic sounds like what medicine that Mrs. Martinez talked about when she was talking about urinary elimination. So diuretic means it's going to promote urination. Anti-diuretic means it's going to diminish urination. So basically, just real quick review, our kidneys have roughly 180 liters of blood pumping through them in a single 24-hour period. And all of that runs through the filtration process of the nephron. And then it is recollected, and only what needs to be lost is made into urine. The rest is reabsorbed back into the blood vessels to be able to continue to be used. So once it's been cleansed, if you will, then it's put back into the bloodstream. ADH is one of the hormones that tells the kidneys, we need you to save more water this time, okay? So we got plenty of sodium, we got plenty of potassium, we got plenty of these calcium and magnesium, but we need a little more water, so save a little bit more than you usually do. And that's what ADH does, is it promotes the reabsorption of water. Where does it come from? It comes from the pituitary gland, right up there next to our hypothalamus. And so the hypothalamus says, we need some help. Pituitary, would you do your thing? Pituitary says, right on it. Sends it into the bloodstream, goes to the kidneys, and then it affects the kidneys in that positive way. Tongue wall, aldosterone. Talk to me about it. What does it do for us?